In today's video, we are going to discuss a very unique, very challenging and very different case of hair transplant, which probably a hair transplant surgeon would do only once in his lifetime. This case was about axillary hair transplant, axillary or armpit. So armpits are the areas where this hair transplant was performed. These armpit hairs have a very important, useful function that this prevents the skin-to-skin contact between the arms and the chest so that there is no rubbing of the skin. It is very useful whenever you're doing activities like running or walking and any other arm motion. In females, there is a tendency to remove these armpit hairs for cosmetic reasons, and on the other spectrum, there are males who are worried by the lack of these hairs. So one such patient from Vietnam approached to us with very minimal armpit or axillary hairs, and this he linked with his loss of masculinity. He said that he was not masculine enough and he wanted a hair transplant in this axillary region. So friends, we tried to research scientific literature for this, and to our surprise, we found out that there was no such literature available, and this was going to be one of the first cases in the world where we did an armpit hair transplant. So we had to plan it on our own. So this being a new and a challenging case, we were keen to perform the procedure. We discussed this openly with the patient that there is no such case reported in the literature and there is no ready-made available literature about this. After discussing and all these disclaimers, he also expressed his willingness to undergo the procedure. Such was his desperation about this procedure. After doing all the initial preliminary investigations, we did his procedure. The first step was to identify the direction and orientation of the existing vellus or fine hairs which are already present in the armpit. We bifurcated or divided the armpit or the axilla into two parts, the one towards the arm and one towards the chest, and then we marked the direction of the hairs in each of these portions or part of the armpit, and there was a demarcation of the boundary of axilla as well. In the depth of this armpit, there is a very important blood vessel going on by the name of axillary artery. This we palpated, sort of perceived the distance below the skin and found out how safe it was to perform the procedure in this case, and the orientation of hair was also marked in the axilla. Here you can see the axillary vessels marked in red color. Then we started the procedure. We gave local anesthesia all around in the periphery as a ring block, and we bent the needle to make the sides or the slit. This was double bent. Then we made the sides trying to mimic the normal hairs, which are baby hairs which are present, and its direction. The orientation of these hairs changes at the apex part of the axilla, which is the topmost part. It's like a pyramid. If you see, the armpit is like a pyramid. One part is going towards the arm and other part is going towards the chest. So the top of this is known as the apex. Approximately we made around 250 slits on each side, and then the graft were harvested in a usual fashion from the scalp by FUE method. Insertion was very difficult for our team to do in this area because there was no support. In the scalp, what we see, we have a bone here which gives us a firm support along which where we can do the transplantation or insert the graft easily, whereas the axilla or the armpit has a mobile loose skin which is moving a lot. So insertion is very difficult in such kind of cases. We did this procedure long back, 5 to 6 years back, and this patient came to us after 5 to 6 years. He did not trim these hairs even once, and you can see the kind of growth he had. In this video you can see we combed these armpit hairs and they was quite long and they had a good growth. They looked very natural. It would have looked even slightly more natural if we had sort of trimmed them routinely and regularly. The same was seen on both the sides. So what we want to share this, if there are any patients who are looking for this difficult kind of hair transplant, it is not something which is impossible. This can be done, but it has to be done in a very specific way. The procedure has to be done very meticulously. We have to mark the hairs. We have to preserve the underlying structure. We have to take extreme care that the underlying structures are not damaged. We have to keep specific precautions about the angulation and orientation of the hairs in the axilla. If it is done properly, it can be very satisfying, and it was very satisfying to this patient, and it was a challenging case in which we got good results. So in this manner, it was very satisfying for us also. So if you like this video and if you are planning such a procedure, you can write down in the comment section below, or you can call us at the numbers given here or WhatsApp on these numbers. If any of your family or friends are planning any other hair transplant apart from this also and want our help in planning, then you can always share this video. You can subscribe to our channel to keep on watching these useful videos. We have an app by the name of Saraswat Hospital where you can see the kind of results you can get. It's an artificial intelligence software or an app for the first time in the world, and it has a customized input from our ABHRS doctors which tell you about the kind of results you can expect, the number of grafts needed in your particular case, and at the same time we share with you list of questions you should be asking your hair transplant doctor, and it's absolutely free, available on both iOS as well as Google Play Store. If you want to see one of our latest hair transplant videos of a patient and its result, you can click the video on the left. And if you want to know cost of hair transplant and the factors affecting the cost of hair transplant, you can click the video on the right.